Hi, I'm Dr. Joanie Davis, owner of Davis Family Hearing. Welcome to our second installment of our YouTube channel, Here Today. On this show, we talk about beyond hearing aids. We talk about the best way to hear, the best way to treat your balance problems, and just educate the general public on all of the treatment solutions out there. There's so much information and misinformation about hearing loss treatment, and the first one that comes to mind is hearing aids. We all know that there's a ton of information out there about hearing aids, and there are a lot of different people who treat hearing loss. So there are hearing aid specialists and there are doctors of audiology. The difference between a hearing aid specialist and a doctor of audiology is that a hearing aid specialist, in order to be licensed, is required to have a 6-month apprenticeship underneath another hearing aid specialist and to take a test. Doctors of audiology go through 8 years of schooling, of which the last year is their residency with 100% 1 full year of supervised patient care. There's a huge difference in knowledge that you're going to run into. Frequently, in my office, people will come in frustrated with their hearing aids. And there are a lot of different reasons for that, and some of those reasons I'm going to discuss in another show, but I'm going to stay on topic for this show because I want to talk about cochlear implants today. But in some instances, just a simple reprogramming of the hearing aid to get the appropriate prescription in the hearing aid completely fixes the problem. But sometimes during the hearing test, we become aware that a hearing aid is not going to help this patient. That a top of the line, most expensive hearing technology out there is still not going to improve this patient's hearing. And the reason is because people can have distortion in their ears. So volume, or how loud sound is one thing, but how clear sound is another. My patients frequently tell me that they can hear that people are talking, but not necessarily understand what they're saying. And sometimes it's because their hearing nerve itself is so distorted that a hearing aid can make sound louder, but not clearer. The best analogy I have for it is, think about old speakers. When you have a blown speaker back in the day, what did it sound like whenever you turned it up louder? Louder distortion. That's what's happening with a hearing aid. The hearing nerve is distorted. We can turn the hearing up, but we can't fix the distortion if the mechanism itself that's delivering the sound to the brain is distorted itself. That's when we move on to a cochlear implant. So what is a cochlear implant? There are 2 parts to a cochlear implant, an internal portion and an external portion. The internal portion, which I have right here, is the internal electrode array. There are 3 different cochlear implant manufacturers. Cochlear, well, I was going to say Cochlear Americas, but Cochlear is also an international company, but I deal with Cochlear Americas, Advanced Bionics, and Medel. They're all 3 wonderful manufacturers, and we work with all 3 of them, but they all have their own internal device. This internal device is meant to stay for a lifetime. So if a child is born deaf, a hearing aid is not going to help them because there's no mechanism to receive the sound. That's when we implant a cochlear implant. This does entail surgery, so I have several cochlear implant surgeons in the Tampa Bay region that I work with. And the way that the surgery goes is the surgeon makes an incision behind the ear. It's the same day surgery. You go home the same day, folds the ear over, and gets into the inner ear that way, deep into the temporal lobe. This electrode looks like a snail. That's because our inner ear is where the damage is, where the distortion is. So this snail goes into the inner ear portion to directly stimulate the hearing nerve. What we've done is bypass the distorted part of the ear so we can deliver true natural sound to the brain itself. We're hearing electrically, which is very different than hearing acoustically. So at first it sounds like beeping or robotic or staticky. I always say the first day is the worst day when we turn a cochlear implant on. But because the brain is plastic and can adapt to the stimulation that it's receiving, after about a week, a door slamming sounds like a door slamming. After about a month, the patient is really starting to gain some understanding of speech. After 3 months, they're really noticing a dramatic difference in their communication ability. After 6 months, they're very happy they decided to get a cochlear implant. And after 1 full year, the brain has 100% developed or adapted to hearing electronically. So this is the part that goes in the inner ear. But you can see in my model of the ear here, this is where the hearing nerve itself is. Over here is where it's innervating. And the actual, right here actually, and the actual magnet itself sits right here, over top of the skull, underneath the skin. Now, why do we need a magnet? We need a magnet because we need a way to receive the electrical sound. So just the implant itself doesn't give you sound. We have an external part that picks up the sound, much like a hearing aid. So we have a microphone, and here's an example. We have a microphone. There are 2 ports up here to pick up the sound. There's a computer chip in the processor. This is called the processor. This is the external part. There's a computer chip that treats the sound much like a hearing aid does. But then that computer chip turns the sound into electricity, and it goes up a copper wire, because copper is good at transmitting electricity, to a magnet. Well, when the patient has this over their ear, they're still not hearing. But this magnet connects to that magnet on the side of the head, and as soon as the 2 magnets touch, the sound from this coil is delivered to the internal magnet, and the patient can hear. It's a miracle for people who have been struggling for years and years and years with hearing aids. And in the past, we have waited a long time to implant people because technology wasn't as good as it is now. So we would wait until somebody got 0 benefit from hearing aids, or they couldn't hear any sound at all. But as technology has gotten better and better and better, we don't have to wait. The criteria for, I'll just use Medicare's criteria because we want the insurance company to cover it, and most insurances follow Medicare's criteria. But the criteria is that the patient understands less than 40% in background noise appropriately aided. Think about that if you're watching this right now. Think about how many people you know who struggle with hearing loss, or maybe yourself, who can't understand 40% in background noise. It's truly a miracle. It truly delivers great understandable sound quality. But on top of it, it functions with hearing aids as well. So a lot of people have a cochlear implant on one side and a hearing aid on the other. We call that a bimodal configuration. There are bilateral configurations where you have a cochlear implant in both ears as well. And then there are some people who choose to wear one, although 2 ears is always better than one. Because cochlear implant manufacturers also partner with hearing aid manufacturers. So Advanced Bionics partners with Phonak. Cochlear partners with Resound. Resound and Phonak are hearing aid manufacturers. They piggyback on the same technology. So the processor and the hearing aid talk together, but they can also connect directly to electronics. So this little microphone right here is called a multi-microphone. If you're in a restaurant with a loved one and they put it right on their shirt, their voice goes directly to your cochlear implant and hearing aid. Whatever this is next to is what you're going to hear. So if you set it in front of the TV speaker, it streams directly to your devices. You have about a 75-foot range in your house. You can get up and get a snack, go to the restroom while you're watching TV, and still have true, good, clear sound quality. It sounds like you're wearing a pair of headphones. But one of the biggest advances is the Bluetooth capacity. So this is 900 megahertz signal, but now hearing devices Bluetooth directly into your cell phones. So if you have an iPhone or an Android that is, I'll just use an example of a Samsung phone, Samsung 9 or greater, and there are Google Pixel phones that are compatible as well, and there are more and more and more Android phones that are compatible. When you answer the phone, it goes directly to both devices. So people who haven't talked to their son in another state for years and years and years because their son calls and they can't hear on the phone and give the phone to their wife, and they haven't had a good, really good heart-to-heart with their child, now can have conversations on the phone. It's truly life-changing. One of my favorite moments is to call somebody who hasn't been able to talk on the phone for a very long time. So the point of me talking to you about cochlear implants, and in the future I'm going to bring a guest on, I'm going to bring some patients on so you can hear their story, is to give you hope. If you are frustrated with hearing aids, don't hesitate to come in and have a consultation at either Davis Family Hearing, or if you are in another state, feel free to contact us and we will find you the nearest cochlear implant provider in the area so you can undergo a cochlear implant evaluation. But just know that there's hope. So many people have seen maybe a hearing aid specialist who isn't educated in hearing beyond hearing aids, as in cochlear implants, and you've been told that there's nothing that can be done and that's the best that you can get. And I'm here to tell you that it isn't. So stay tuned for our next installment. We'll be posting in a week or so. But if you want more information, don't hesitate to call us at 352-666-8910. Visit us online at davisfamilyhearing.com. Continue to watch this YouTube channel and subscribe. Check us out on Facebook, Instagram, Twitter, any social media platform you can think of. And also tune into my radio show Here Today on Apple Podcasts. Just download the app and search Here Today, and you can hear my live radio show every Friday on 99.9 WXJB FM, and people call in with questions that we answer on the air. If you have a question you'd like me to address in the future, please just put it in the comment section underneath this YouTube video, and I'll be happy to integrate it into future shows. Thank you very much for watching, and have a blessed day.